Recording. Okay. Hi, everyone. My name is Anthony McClory, and this is my patient presentation on hemophilia. The patient who has hemophilia is named Angus Scott. He is a white male and is of the age of 28. He doesn't practice any religion but believes that there is something of a higher power out there. He lives in Macomb, Michigan, and lives in the suburbs. He is part of the middle class and speaks English. Angus Scott's complementary and alternative medicine beliefs are manipulative and body-based practices and energy-based practices. Manipulative and body-based practices are a type of therapy that involves a therapist that moves or manipulates your body to treat pain, stress, and anxiety. These practices include things like chiropractic, physical therapy, and massage therapy. Energy-based practices work on your aura and energy fields around your body to help your body. Examples of these include Reiki and acupuncture. Angus Scott's interests include working out, playing soccer or watching it, painting, and crystals. He knows some of these things can be dangerous since he has hemophilia, like soccer, but he doesn't want the disease to stop him from doing what he loves. Angus Scott suffers from the disease of hemophilia. This disease is an inherited disorder that causes the blood in the body to not clot because of missing proteins that the body cannot create. Once bleeding starts in the body, there's a certain medication that is used in order to stop it. There are many signs and symptoms that occur when someone has hemophilia. Signs and symptoms include excessive bleeding, many large or deep bruises on the body, unusual bleeding after vaccinations, joint pain, blood in urine or stool, and random nosebleeds. The etiology of the disease hemophilia is that it is carried on the X chromosome. The F8 gene that is found on the X chromosome is mutated, which causes the disease hemophilia. Hemophilia is a recessive gene that is passed down. People with hemophilia disease have a decrease or absence of a clotting factor VIII in the plasma. Since the body is unable to produce the factor VIII in the blood to be able to stop the bleeding in the body, the site of the injury continues to bleed. The bleeding can be stopped with the use of pressure in less severe cases, but for most part, people with hemophilia have to use medication in either to prevent the bleeding or to stop it when bleeding occurs. Hemophilia can affect both males and females, and it doesn't matter the race or ethnicity of the person with the disease. Though for most part of the disease affects males more than women. On the rare occasion that a female does gain two X chromosomes with the mutated F8 gene, then they will experience the signs and symptoms that a male does. Approximately 1 in 5,000 males are born with hemophilia. The reason why males are affected more than women is because it is easier for them to gain one X chromosome with the F8 gene on it than two X chromosomes with the mutated gene. Also, men can't pass on the gene to their child if their child is a boy. But the mutated gene can be passed on to a daughter, and that daughter will become a carrier of the mutated gene. But she will not show signs or symptoms of the disease. Women can pass the disease down to either a boy or a girl. The boy will show symptoms, but the daughter will just be a carrier as well. The first type of test that can be used in order to determine if you have hemophilia is a screening test. The first one of the screening tests that can be used is the complete blood count test. The complete blood count test is used to measure the amount of hemoglobin, the amount and size of the red blood cells, the amount and types of white blood cells, and the amount of platelets in the blood. During screening of this test, people with hemophilia usually come out as normal, but if they are experiencing a lot of bleeding, then the patient's red blood cell and hemoglobin count will be low. The second and third screening tests are the activated partial thromboplastin time test and the prothrombin time tests. These tests show how long it takes for the blood to clot, and if the blood takes longer to clot than normal, it will show the patient has hemophilia. The fibrinogen test also tests how long the blood clots. The other type of test for hemophilia is the clotting factor tests. These tests are required to diagnose a bleeding disorder to show the severity of the hemophilia a patient has. The first treatment that Angus Scott uses in order to treat his hemophilia is recombinant factor concentrates. This is a medication that is taken by injection. Angus is injecting a genetically engineered clotting factor 8 that is used to stop bleeding when it occurs. This treatment for Angus is used sparingly because the medication becomes useless if his body inhibits the drug, but it is used sparingly in order to stop the bleeding when it occurs. This drug reduces the stress if a bleed does occur for Angus. The second treatment that Angus Scott uses to help treat his hemophilia is antifibrinolytic medicine. This is a medication that is taken daily in order to prevent and help blood clots from breaking down when they start to form when Angus has a bleed. Angus uses the medication to help him feel better about his condition. This medication he takes every day gives him the comfort in his condition because he knows he is using something that will help him prevent a bleed that won't stop. The third treatment Angus uses for his hemophilia is physical therapy. This treatment comes from Angus's complementary and alternative medicine beliefs. It fits in with the manipulative and body-based practices. Physical therapy works on making the muscles stronger and joints work better in the body, and with this, it allows for fewer bleeds to occur. The physical therapist works with Angus and assesses his strengths and weaknesses that he has, and they work on them. This treatment is also preventative for the future. Physical therapy helps joints and muscles work better in the future, and with this treatment, Angus will need less rehabilitation when he is older. The fourth treatment that Angus uses is Reiki. Reiki is an energy medicine that helps with the flow of energy in the body and removes the energy blocks that are in the body. This treatment sometimes uses crystals on different parts of the body, and this is one of Angus's interests, and this is why he likes it. He believes that crystals help with the energy flow as well, and the properties that come with different types of crystals help with his daily life. Reiki is also used because it helps the anxiety that comes with having hemophilia. It stops Angus's worry of having the disease. These are my references that I use for the presentation.